Good morning to all of you. You are warmly welcome for today's CPD program, which has been organized by GMOA Sri Knowledge Academy. The webinar link for this session will be open to you from 9 to 9:50 a.m. and no late attendees will be entertained thereafter. All participants should attend the webinar till the end of the webinar to apply for the e-certificate. The CPD points will be given to you, which are strictly adhered to the NCCPD guidelines. Anyway, the certificate will be released to you regardless of the CPD points. You can use the chat box for your queries. The answers will be discussed at the end of the webinar. Also, we kindly ask you to mute your microphone and switch off the video to avoid any interruption during the session. Now, let me introduce today's speaker, Dr. Rishita M. Vijay Surya. He's a registrar in sports and exercise medicine at Colombo North Teaching Hospital, Ragama. And he has qualified with the diploma in sports and exercise medicine. And currently he's an MD training. Also, he has done a couple of researches and studies on this field. Surely he's expert in this field. Currently, he has engaged in physical activity promotion programs with the NCD unit at Ministry of Health. So I invite you and I invite Dr. Rishita to do the today's lecture on live a fit life with the exercise. This is over to you, Doctor.
Okay. Good morning, everybody. It's my honor and pleasure to address you all through this platform. I was asked to do basic of exercise and fundamental things on physical activity. It is vast area. I will try to cover in my best in one presentation. So today outline is I will talk about fitness, exercise, and briefly at the end I will touch on obesity and fat losing principles. So why do we need to be fit? What exactly is fitness? It doesn't mean that you can lift really heavy weights or even run a marathon. People who can do that are certainly fit, no doubt. But what about ordinary people like you and me? We all have one life. To live that life up to the fullest with good physical, mental, and emotional health, we need to be fit. And benefits of this fitness don't come not only to you, it is for individual, family, society, economy, environment, and finally to the country. What is physical fitness? It is ability to carry out daily tasks with vigor and alertness without undue fatigue and with ample energy to enjoy leisure time pursuits. So let's see like this. After work or duty, if you go home mainly to eat and sleep, or if you don't have energy to do household work or play with kids, you will blame to workload, or you blame yourself or you label yourself as a busy person. You carry the remaining work of the day forward, and ultimately whole life is disorganized and untidy. Original reason can be the lack of fitness, but it is hidden inside you. Fitness can be considered as physical fitness and mental fitness. You may be in good health now, but what about your fitness? Are you sure that you will have the same state of health tomorrow? We think that obesity is the only factor that can affect our fitness. Do all obese people are unfit, or do all thin people are fit? Surprisingly, evidence suggests fat and fit has lower mortality than thin and unfit. Components of physical fitness can be divided into two categories. Here I will give more weight on health-related components, as skill-related components are more important in sports person and athletes. According to health-related physical fitness components, there are cardiorespiratory endurance, body composition, muscular strength, muscular endurance, and flexibility. Then skill-related physical fitness components are agility, coordination, balance, power, reaction time, and speed. Let's see what is this cardiorespiratory endurance. It is the ability to deliver oxygen and nutrients to tissue and to remove waste over a sustained period of time. Aerobic exercises are mainly done targeting this cardiorespiratory endurance. Then what is body composition? The makeup of the body can be divided into lean mass and fat mass. Lean mass includes muscle, bone, vital tissue, and organs. Those are metabolically active tissue. Our BMR, that means basal metabolic rate, depends mainly on lean mass. 65 to 75% of our daily energy requirement is used by basal metabolic rate. So when we have high BMR due to high lean body mass, we can eat more without gaining weight. Usually fat mass less than 32% in female and 25% in male are recommended. Above those values belongs to obese category. Then what about muscle strength? It is the ability of muscle to exert force for a brief period of time. Strengthening exercises are used to improve muscle strength, such as lifting weight, push-ups, squats. We will talk about those parts later, about that when we talk about the exercise. So then what about muscular endurance? It is the ability of muscles to sustain repeated contractions or to continue applying force against fixed object. Here also we do strengthening exercise to improve muscular endurance, but in low intensity. High repetitions are used in contrast to muscle strength. Then flexibility. It is the ability to move joint and use muscle through their full range of motion. So we have flexibility exercise to improve the flexibility. And again, European Society of Cardiologists has described those components in a collaborative way. So someone's fitness will not depend on one or two isolated factors. For example, can we select the most fit person here? Is it A, B, or C? Now, we can't say in that way. What we can say is B looks like having good body composition, but we don't know about other components such as cardiorespiratory endurance, muscle strength, flexibility, muscle endurance. We can't comment on those aspects. In a certain special situations, mastering one component more than the body composition will be beneficial. It can be cardiorespiratory endurance, muscle strength, speed, coordination, or other skill-related physical fitness components. But general person should select exercise considering to improve all the components of physical fitness into certain extent when we are planning a fitness program. What is physical activity? Physical activity is defined as any bodily movement produced by skeletal muscles that require energy expenditure. There is a dose-response relationship between physical activity and health benefits. Then what is exercise? It is a type of physical activity consisting of planned, structured, and repetitive bodily movement done to improve and or maintain one or more components of physical fitness. I think now you know about the components of physical fitness. So basically we do exercise targeting one or more physical fitness component. Before I move to next slide, I want to play a small video clip. We will watch it and come. Sound right? More. නෑ මම කම්පියුටරේ සවුන්ඩ් එක දාන්න. ඒක ලේසි නේද?
Hamburger? Sure. I think negatively affects people's health more than anything else. Alcohol? Cigarettes? The donut? Hamburger? Sure, they're all pretty bad for you, but most people know that and at least try to limit their intake somewhat to these items, even a little bit. But it's the things we don't think about that can really cause damage. Things we use every day so regularly we don't even think about how its constant use could actually be killing us. The real culprit is the chair. We were given legs for a reason. Most third world cultures don't even have chairs, and they walk an average of 10 miles a day. We in the modern world, on the other hand, spend most of our entire waking days sitting down. People go right from bed to sitting on the toilet, after which they sit at the breakfast table, then they sit in the car as they drive to work and spend the entire day sitting at a desk, only getting up to sit in the toilet and in the cafeteria. Then they sit in the car to drive and sit at the local bar for happy hour. Then when they've had enough of that, they go drive home and spend the rest of the day sitting in a comfortable chair watching TV before they crawl to bed to recover from all the physical exertion that day. And when people go out, they sit at a restaurant or a movie theater. Sitting all day is far worse for you than you might think. A 2010 American Cancer Society study following over 123,000 people from 1993 to 2016.
Okay. According to this video, this is the new entity called sitting disease. That should be considered more seriously if we are thinking of being active and fit. This sedentary behavior is the result of our normal routine. Unless we are brave enough to break it, lifestyle is not going to change automatically. So, what is sedentary life? Any waking behavior characterized by an energy expenditure less than 1.5 minutes, such as sitting, reclining, or lying down. Can an exercise person be sedentary? Yes, we may be doing morning exercise up to the recommended level, but we spend rest of the day on a chair being sedentary. In that case, benefits of exercise can be overcome by negative effect of sedentary behavior. Therefore, this is not only about your daily exercise routine, but it is about your whole lifestyle. It is advised to target minimum of 10,000 steps in the rest of the day to minimize the sedentary effects on health. I will briefly mention the evidence-based benefits of being physically active before we discuss about the exercise. Regarding brain function and mental health, physical activity reduces risk of cognitive decline and risk of dementia, including Alzheimer's disease, and reduce both state and trait anxiety, reduce depressive symptoms and frank depression, and physical activity improves the overall sleep quality. Regarding cancer prevention, improves quality of life and reduce risk of recurrence in cancer patient, and reduce risk of bladder, breast, colon, endometrial, esophageal adenocarcinoma, renal and gastric cancers. In contrast, sedentary behavior increases the risk of endometrial, colon, and lung cancer by 20 to 35%. Regarding cardiometabolic diseases, physical activity decreases incidence of cardiovascular disease, stroke, and heart failure, and it reduces blood pressure among adults with pre-hypertension and normal blood pressure. Regular medium to high intensity aerobic activity reduce blood pressure by mean 11/5. Physical activity increases vascular nitric oxide, which is responsible responsible for vasodilatation, which lowers peripheral resistance and increase vessel perfusion. The antihypertensive effects of physical activity are mediated through enhanced baroreceptor sensitivity, decreased norepinephrine level, reduced peripheral vascular resistance, improved insulin sensitivity, and alteration in the expression of vasodilator and vasoconstrictor factors. Aerobic activity decreases left ventricular mass wall thickness and arterial stiffness and increases central nitric oxide synthase activity. Finally, these adaptations contribute to superior endothelial function. And long-term endurance exercise increase parasympathetic activity, that means vagal tone at rest, which is a good indicator about fitness adaptation of the body. The epidemiologic studies found greater reduction in risk of cardiovascular disease with vigorous than with moderate intensity. And there is dose response fashion between antihypertensive effect of exercise and the exercise intensity. Regarding diabetes mellitus, physical activity improve insulin sensitivity, improve blood lipid profile, decrease resting heart rate and blood pressure, decrease body weight, and decrease risk of coronary heart disease. It reduces the risk of developing type 2 diabetes. In comparative study, physical activity prescription is effective as drug intervention in terms of its mortality benefits in the secondary prevention of coronary heart disease, diabetes, stroke rehabilitation, and heart failure. Famous DPPP trial also conclude the importance of physical activity in the primary prevention of type 2 diabetes mellitus. Regarding pain reduction, physical activity may be as effective as NSAIDs. And regarding musculoskeletal health, vigorous physical activity does not accelerate osteoarthritis in normal joints. Aerobic and resistance activity reduce pain and improve physical function and quality of life for both osteoarthritis of the knee and hip. Physical activity provides stimulus for prevention and treatment of osteoporosis via the process of mechanotransduction. Regarding weight management, physical activity is not a primary independent solution to weight loss. That means physical activity alone can't solve the obesity. So prospective studies demonstrate an inverse association between physical activity and both weight gain and incidence of obesity. That means physical activity can control weight gain and can prevent obesity, but it is not only solution for obesity. And positive association between physical activity and maintenance of a BMI within the healthy range. That means physical activity can maintain your BMI in healthy range. For cutoff limit of BMI, for Asians, this is the general cutoff limit 18.5 to 25, but Asians 18.5 to 23 is can be taken. For healthy aging, physical activity maximize older adult functional ability and independence, and physical activity decrease all cause of mortality by up to 35% and allow for long life, longevity. Physical activity does not give only health benefits, it also gives social well-being also. It improves mood, reduce stress, improve self-esteem, improve body image, improve confidence, and build positive attitudes and habits. Now we know what is physical fitness and importance of it. Let's see how to achieve this fitness. It is mainly through exercise, minimizing the sedentary behavior, good nutrition, good sleep. That means good recovery. So this is Prof. Jerry Morris. He's a Scottish epidemiologist credited as the man who invented exercise. He established the importance of physical activity in preventing cardiovascular disease. This was his observation that sedentary drivers of London double-decker buses had higher rates of cardiovascular diseases than did the conductors who climbed stairs. Similar findings were seen in London postmen and less active clerks at the post office. So in 2017, WHO identified physical activity counseling and referred as as part of routine primary healthcare services as a cost-effective best buy for tackling non-communicable diseases. So, but changing someone's behavior is difficult, especially from sedentary chronic state to active lifestyle. It should be done in an organized manner gradually. For this purpose, various models and theories have been proposed. I have put only 2 models here just to mention about it, but this important topic requires separate talk. Every person should go through this physical activity readiness questionnaire before commence any exercise routine. This is a self-screening questionnaire that can be freely downloaded if you find download from the internet. If you find even single yes answer in that screening, you better get a medical clearance from a sports doctor. Especially people who have recently had surgery, pregnant women, people aged 40 years or more, people with pre-existing medical conditions such as heart disease, people with pre-existing musculoskeletal injuries or disorders, anyone who has not exercised for a long time, and people who are very overweight or obese should be considered. Then it is difficult to categorize all types and exercise patterns in one slide, but there are basic types of exercise we should know. Basic types are aerobic exercise, that is also called cardiorespiratory endurance exercise, strengthening weight bearing exercise, also called anaerobic exercise sometimes, and flexibility exercise and neuromotor exercise that includes coordination and balance movements. So beginners can start with these basic types. Variety of exercise from each basic type is important for our exercise routine to address all the components in physical fitness. Other special workouts and patterns can be learned when you go on in this fitness track. So let's see about aerobic exercises. In order to improve the cardiorespiratory endurance component in the physical fitness, as well as according to the recommendation, we have to select aerobic exercise for our exercise routine. Here we have a list of aerobic exercise: cross country skiing, jogging and running, skipping, aerobic dance or jazz exercise, swimming, bicycling, skating, jumping jacks, running in place, stair stepping, walking, indoor aerobics, chair aerobic, and we can use aerobic exercise machines. So you have to choose one aerobic, one or two aerobic exercise from this list. Obviously, don't pick up cross-country skiing or ice skating as your aerobic exercise. Then you have to wait until there is a winter season in Sri Lanka. So select what is enjoyable and practical to your setup. It can vary time to time, and you can experience different types when you are in the correct fitness track. So regarding strengthening exercise, people forget strengthening exercise usually, but major part of fitness can be improved with this type. It can be done even at home. For a beginner, core muscle strengthening home exercises can be initiated. Those are Pilates, lunges, planks, calisthenics, windshield wipers, crunches, squats. This is she's doing lunges. So this is dumbbell weighted stationary lunges. So this guy is doing calisthenics. In calisthenics, we use our own body weight. This is plank. This is windshield wiper exercise. This is abdominal crunch, and this is squat. It is important to master the correct technique for each and every type before you advance the intensity. Wrong technique will lead to musculoskeletal injuries. It is good at the beginning if you can focus more on core strengthening than individual muscle, because biomechanically core is responsible for every major movements in the body. If you have a strong core, your ergonomics will improve. That means you will do your day-to-day work easily with less effort. If you are interested, you can read about what are the core muscles and its function. It is really interesting and important. Let's see about plank. Basically, we target to achieve at least 30-second plank, but you can progress with time duration. Here, learn the correct technique. We should keep our neck and head in neutral position, and elbows just below the shoulder, and our core muscles, that means mainly abdominal and glutes, should be tight and contracted, and our back should be in a straight line. So that is the basic technique, but we can increase the intensity by putting weight over the back, or ask kids to be on back, and we can get this elbow a little bit forward. That will increase the intensity. Same principle is valid for this lateral plank or side plank. Also, keep the head and spine neutral. Engage your core. Then lift hip and knee off the floor. This is plank. Then little bit about squat. This exercise is considered as the king of strengthening exercise. Therefore, don't forget to add this into your workout schedule. So technique wise, stand straight with feet hip width apart. Tighten your stomach muscles and glutes. That is called core engagement. So engage your core. Then lower down as if sitting in an invisible chair. So you are lowering your body with hinging your hips. Don't bend your back. Don't let your knees come forward beyond toes. Then straighten your legs to lift back up. Repeat the movement. So wrong technique can cause knee pain due to patellar tendinitis or back pain. Progression can be done with dumbbells or barbells once we master the basic squat. So we have to master basic squats at least up to 3 sets with 8 to 12 repetitions. I'm going to talk about reps and sets later. So then regarding lunges. So this is stationary lunges. So one foot in front of other, drop the body straight down. Body does not move forward. Keep the back straight. Then after doing couple of lunges, in that position, you can change the leg and do the same movements. There are so many variations of lunges. Main things are walking lunges, like in this guy is doing the walking lunges, and there is reverse lunges and side lunges, and we can add plyometrics part with a jump to these lunges as shown in this orange color lady. So regarding Pilates, this Pilates exercise was introduced by Joseph Pilates in 1920 to help injured athletes and dancers in America. It has aerobic and anaerobic form of exercise. It requires concentration and focus. It stretches all the major muscle groups in body in a balanced fashion. So each exercise has prescribed placement, rhythm, and breathing pattern. In Pilates, muscle are never worked to exhaustion. So there is no straining. The workout consists of variety of exercises. The exercises are performed in low repetition, usually 5 to 10 times over a session of 45 to 90 minutes. Mat-based Pilates and tension bands or equipment-based Pilates are used. Tension bands can be used to add more resistance. Pilates improve flexibility, strength of core muscles, balance, breathing capacity, helps in stress management and relaxation. Total full workout with Pilates, so selected exercise from Pilates can be used to make your own workout. So we talk about the core strengthening exercise. There are other important strengthening exercise which can be done at home. So those are push-ups, sit-ups, TheraBand exercise, plyometric. So in push-ups, there are so many variations. But as a beginner, first master the basic format and then advance. In basic push-ups, like in this diagram, in basic push-ups, head is in neutral position, shoulder, elbow, hand are in the same line, back is straight, core is engaged, as we discussed before. Core should be engaged. And try to do full range of movement. And your hands are kept apart, similar to your shoulder width. That is the basic format. Techniques are important here. And there is a technique for breathing also. You have to exhale with the force or with positive movements and inhale when you come down or with the negative movements. For the people who are difficult to do basic format, can try ladies push-ups, like in this photo. So, or they can do wall push-ups. Later, you can advance the incline and give more weight to the push-ups. In most advanced stages, you may be able to do this inverse wall push-ups or handstand push-ups, but never try this as a beginner. TheraBands are cheap and readily available user-friendly item. Those can be used even for full body strengthening workout. There are different colors and with different strength. Plyometrics are used basically to improve muscle power. This is one type, and this is sit-ups. Better to know the difference between sit-up and abdominal crunch. Both look similar, but in abdominal crunch, we focus more on upper abdomen, but in sit-ups, it is mainly lower abdomen. So, progression of resistance training can be done up to a certain extent at home, but real progression can be achieved with gym-based strengthening equipments and machines. If you are a new person to a gym-based workout, it is important to know these basic principles and techniques first. As I told you previously, try to achieve little core muscle strength with home workouts before you join to a gym. Then you can do better with the equipments. It will improve your confidence at the gym setup. Females go to salons, but I invite them to choose gyms instead of salons, because real beauty comes with the fitness. And also, gym is cheaper and give more benefits. It is good investment for your fitness. And there are certain terms we should know. As I have mentioned here, there are certain terms, repetitions, set, 1 repetition max, DOMs, bulking and cutting. So we should know about this term before we start this gym workouts. A rep is repetition is the number of times you perform a specific exercise. Set is the number of cycles of reps that you complete. For example, suppose you complete 15 reps of bicep curls. So take this bicep curls as example. So bicep curls, you complete 15 reps. You would say you have completed one set of 15 reps. So 1 repetition max is the maximum amount of weight that a person can possibly lift for a 1 repetition. Then DOMs. DOMs is delayed onset muscle soreness, which is significant at the initial period until you get conditioned. In the following day of your first gym day, you may feel body aches and pain depending on your intensity and eccentric movements. Sometimes you may find difficult to get down from the bed even, but it is physiological. Give some rest and nutrition to your body, or if it is severe, you can take simple analgesics. There are various physiological mechanisms are proposed, but in easy way, we can take DOMS are due to micro tears of the muscles. With that lesson, muscle will be ready to face that challenge well in next time. Bulking pace means we target muscle hypertrophy with low reps and heavy resistance while you're giving enough calories and protein. In the meantime, it is unavoidable to gain of extra fat mass also with the lean mass. In the cutting pace, you try to maintain your muscle bulk with usual resistance training while giving total calorie deficit with enough protein. Here we target to lose fat mass, but we may lose a little bit of muscle mass too. Somehow, with repeated cycles of cutting and bulking paces, one can improve the body composition with more lean mass and less fat mass. But this is not a job that can be done in weeks or months. That is why people take shortcuts by taking hormones like testosterone or steroids, but they don't know the gravity of the adverse effects. As doctors, we should never entertain those kind of activities at the gyms. And no pain, no gain concept is now outdated. We exercise until the muscle fatigue, not until pain. And shortening rest periods between sets improves muscular endurance. Lengthening the rest period between sets improve muscle strength. So a little bit about flexibility exercise. We can assess our flexibility level by measuring joint range of movement. So by doing simple tests like sit and reach test, there are several types of flexibility exercise: ballistic or bouncing method, dynamic or slow movement, stretching, static stretching, active static stretching, likewise. So stretching is also a flexibility exercise, which we do mainly in cool down part. And also obesity compromises the flexibility and range of movement of the joint. So we should encourage to perform stretching exercise even in the obese setup. So stretching can be done targeting individual muscular tendon units of major muscles of the limb, back and trunk muscles also. Even we are at a working desk, we can try this stretching exercise. We should be able to hold that stretch position for 30 seconds before we change or advance further. Then a little bit about neuromotor exercise. Balance and coordination movement exercise comes under this category. These exercises are very important elders as they reduce the falling risk and improve motor skills, including balance, coordination, gait, agility, and proprioception. Various types of neuromotor exercises are there, to start from simple ones and to advance into very complex movement like this. So due to shifting of the center of gravity in obese people, they tend to imbalance and fall. So fall during exercise. So it is better if they can do neuromotor exercise in their exercise plan. So these are high intensity workouts, just for your interest, not for the beginners. Poorly conditioned people can go into rhabdomyolysis even. In the HIIT, that means high intensity interval training, we do selected exercise in high intensity for a short period, and then come to low intensity for that same period. Then we repeat this high intensity and low intensity cycles for 10 to 15 minutes. This can be done by using treadmill easily if you have one at home. So fitness wise, HIIT, that means high intensity interval training, same as effective as conventional moderate intensity aerobic training. It is proven by evidence. But the advantage is HIIT is having it. HIIT requires shorter time period to burn the similar amount of calorie. So people who are complaining about the busy life and lack of time, they can gain initial fitness by doing usual basic types. Then after they achieve some kind of some level of fitness, they can start this HIIT exercise. Then they can use short periods to gain the same result. As same as the exercise or workout routine, we should think about the recovery part. This is a big topic. I will briefly touch on few points. In recovery, we can give time and nutrition to body, and we can allow to body by giving rest, or we can do active recovery methods. So long walk, yoga at light intensity, foam rolling and myofascial release, swimming, hot and cold bath, steam bath. Those are methods that can improve the recovery. Most importantly, nutrition is very important. So here I will briefly mention about the protein intake. For average adult, it is 0.8 to 1 gram kg per day. For strength and power athletes may go up to 2.4 gram kg per day, but we can say at least keep the protein intake between 1.5 to 2. Endurance distance runners, it is 1.5 gram kg per day. And again, sleep is also important as a recovery method. Then what about exercise recommendation? Now we know the types. We should know about the recommendation. So American Heart Association and European Society of Cardiologists, and we have our own Sri Lankan guidelines also. All are almost same as general recommendation. In American Heart Association, they have described at least 30 minutes moderate intensity physical activity at least 5 days per week. Then totally 150 target. We should target 150 minutes per week, or at least 25 minutes of vigorous aerobic activity at least 3 days per week, targeting almost 75 minutes per week. And we should not forget about high intensity muscle strengthening activities at least 2 days per week. And for lowering blood pressure and cholesterol, they have recommend average 40 minutes of moderate to strength high intensity aerobic activity 3 to 4 days per week. European Society of Cardiologists has guidelines also has the same recommendation. They have level A evidence with class 1 recommendation for those physical activity recommendations. So at least 150 minutes per week of moderate intensity, or 75 minutes week of vigorous intensity aerobic exercise, or an equivalent combination. So we can combine vigorous and moderate intensity physical activity amount to have the final value at the end of the week. So we can again gradual increase in aerobic exercise to 300 minutes per week of moderate intensity, or 150 minutes per week of vigorous intensity aerobic exercise. That is also recommended in European guideline. And they also recommend multiple sessions of exercise spread throughout the week, 4 to 5 days a week, and preferably every day of the week are recommended. And don't forget about kids. So they should at least they should engage in moderate to vigorous intensity aerobic activity at least 60 minutes every day. It is every day. So don't be discouraged if you can't achieve even minimum recommendation at first day. Day by day, you can do progression. There is a dose-response relationship between physical activity and health. So even one single step has a value. So don't be discouraged. So one day you can achieve this minimum recommendation and go beyond that recommendation. So what about if someone can't achieve this moderate intensity 30 minutes recommendation? So in that case, so let's say in elder person, so in that case they can do 10 minutes bouts of exercise. So 10 minutes bouts of exercise can be advisable. How do we know about intensity? Let's see. Now they have talked about the moderate intensity, high intensity. So how do we know about the intensity of exercise? So it is like this. When we are doing the exercise, we should know about the intensity of that exercise. Otherwise, we don't know whether we are doing things adequately to expected benefits, or do we need to do further, or am I too much or at risk of injury? By knowing the intensity, we can say this is low intensity, this is moderate, high, or very high. There are so many ways to measure the exercise intensity. Absolute way is to calculate the MET value, but there are more practical way. We can use our pulse rate to have an idea about the intensity. So pulse rate range can be given to maintain that pulse rate range to have that intensity level. Here we have low, moderate, high, and very high intensity levels. And here there are so criteria. So pulse rate, depending on heart rate max, heart rate reserve, we can calculate. So I have shown example here. Let's see that 40 years old male, he needs to do high intensity aerobic activity. Then he is asking about the pulse rate range, or how do we know about the intensity when he's doing exercise. So we can calculate heart rate max easily, can be calculated by reducing age from 220. Then his heart rate max is 180. So to have high intensity exercise, he should have 75 to 90% of heart rate max. So 75% of heart rate max from 180 gives 135 beats per minute. Then 90% of heart rate max gives 162 beats per minute. Then we can ask him to maintain heart rate, pulse rate, 135 to 162. That will give high intensity exercise for him. And there is a better way. We can use heart rate reserve. So heart rate reserve can be calculated like this. We take heart rate max like before, then we reduce basal heart rate. That means resting heart rate. So we reduce that resting heart rate, then we get heart rate reserve for that person. Let's take resting heart rate is 68. Then his basal heart rate reserve is 152. Then we need to check what percentage of heart rate reserve give the high intensity. So it is 70 to 85. So 70% of heart rate reserve is 160 beats per minute. 85% of heart rate reserve is 129. Then we have to add this value to our resting heart rate. Then we get the final heart rate range. So he needs to keep his pulse rate between 174 to 197 beats per minute to have a high intensity aerobic exercise. Now you can see there are two values. If we calculate heart rate range according to heart rate max, it gives 135 to 162. If we calculate heart rate according to heart rate reserve, it gives 174 to 197. It is because like this, in heart rate reserve, that calculation consider basal heart rate also, resting heart rate also. It is a good indicator of physical fitness. So if someone is having low resting heart rate, that means he is having good vagal tone. So this person is having good vagal tone and he is physically fit. That's why he can go up to 174 to 197. So heart rate reserve calculation is better than heart rate max. Likewise, you can have precise heart rate values. There are so many ways. I describe only two. And easiest way is to go by talk test. That is always easier way. So by doing talk test, when you are doing exercise, if you able to talk and sing, then you are doing it in light intensity. You are able to talk, but you can't sing. That means you are doing moderate intensity. You can't, if you can't even talk, that means you are doing vigorous or high intensity. Likewise, there's an easy way also, but more precisely, you can go by pulse rate. So, little bit about MET. MET in simple way defined as the number of calories expense relative to the resting metabolic rate. MET1 means MET1 means our resting metabolic rate, which is 1 kilocalories kg per hour. So according to METs, if the MET is less or equal to 1.5, that means we are in sedentary. If MET value is in between 1.5 to 3, we are doing mild activities like housework, ironing. There are so many examples in this table. So, and the MET value is 3 to 6 means we are doing moderate activity, and more than 6 means we are doing vigorous activity. You may have heard about the food pyramid, as well as we have activity pyramid also. According to that, we can have idea about what are the activities we should do more. Then for general exercise program, these components should be included. Aerobic, as we discussed, cardiorespiratory endurance exercises and loading exercise, flexibility exercise, neuromotor exercise, and the behavioral interventions to enhance adherence and to reduce period of physical inactivity. So these are the major components that should be addressed when we are planning general exercise program. Another thing, good exercise program should follow these principles, and the exercise prescriptions are done according to these FIT VP principles. FIT VP principle mean frequency, that means how often we do exercise, intensity, how hard, as we discussed previously, and the time, duration, how long we do, and the type, what are the types, aerobic, what is the type, strengthening, what are whether it is core strengthening, push-ups, shoulder press, squats, like that. Then the volume, I will come to that. We need to calculate total volume of the exercise, and the progression, which is most important part. Let's see about the progression. So these are the components should be covered in our exercise schedule. So as a beginner, I am taking you all as a beginners. So from the beginning, we can work it out. So as a beginner, know your 1 RM first. 1 RM means 1 repetition maximum. 1 repetition maximum means the maximum amount of weight that a person can possibly lift for 1 repetition. Is it different from one exercise to other? 1 RM for bicep curls, like in this diagram, bicep curl is not the 1 RM for leg press, like in this diagram. So you have to know your initial 1 RM for each exercise in your exercise schedule. And first start with moderate weight. That means 60 to 85% of 1 RM. Okay, sorry for this overcrowd slides, but you need to have good idea about this progression. First, you start with 60 to 85% of 1 RM. Then you can easily practice the technique correctly. Once you mastered the technique, you can start with 85% of 1 RM, as our gym goal is to improve muscle strength by hypertrophy most of the time. Then we should able to get the exercise up to 8 to 12 reps, at least for 3 sets, before we advance the weight. So we start example. So this person 1 RM for bicep curl is 10 kg. So he selected 7.5 kg at first. Then he mastered the technique. Then he changed the mastered technique, and he's able to do 8 to 12 reps and 3 sets. Then he changed to his 85% of 1 RM. Then he can master that until he can do 12 reps and 3 sets. From that point onwards, we increase 10% from the total volume per week. So not more than that. So we can increase more than that, but there's a high risk of injury. So we have to go always in safe way. 1 week, for 1 week, it is advisable to increase 10% of the total volume. So volume can be calculated by multiplying his weight, 8.5, then sets, 3 sets, then 12 repetitions. So his current volume for 8.5 kg is 306. Then we need to improve by 10% for next week. So we add 10% of that current volume, that means 36. So his new volume comes as 342. Now we need to find what is new weight. So new weight, we come as with this simple maths, we come as 9.5, roughly it is 10 kg. So in next week, he can lift 10 kg, not more than that. So this week he's doing bicep curls with 8.5 kg. Next week he can do with 10 kg. Likewise, again, next week, according to this calculation, he increased by 10% of exercise volume. Then next week he can do 11 kg. Likewise, we can progress gradually. Then those progression can be applied to aerobic exercise also. Aerobic exercise, we can start with mild to moderate intensity. Target initially 10 to 15 minutes initial. Then try to achieve 30 minutes without increasing intensity. So then after you achieve 30 minutes of aerobic activity, you can increase that aerobic activity by 10% per week. So get according to calculation, your initial volume, we multiply 4 kilometer into time duration 120. So we add the 10%, 132. So with simple calculation, we get 4.4 kilometers. He initially ran 4 kilometers. Next week, he can run 4.4 kilometers within that 30 minutes. You can increase the distance for that 30 minutes period, or you can increase the time. So whatever the way, you can progress in aerobic activity, but remember this 10% rule. Usually when we advance, it is difficult to, especially in strengthening exercise, usually when we advance, it is difficult to do whole body strengthening in one day. Then we divide the week into 2 upper body days and 2 lower body days, alternatively keeping the 2 days gap for same region. Then we can progress to high volume training. So that is about progression. Now this is the universal exercise module. So we should do warm up 5 to 10 minutes, then stretching or flexibility exercise. After warming up, then we do our proper workout. It should include aerobic exercise, strengthening exercise, balance and coordination exercise, flexibility exercise. Then ultimately cool down, which also includes stretching and breathing technique. So these are the activities that can be done in cool down session. So these stretching activities and breathing technique will relax the muscles and give a relaxation feeling at the end. Then the home-based session. This is the example. You can do 10 minutes warm-up, then the stretching for 5 minutes, then you do your workout according to the principles, aerobic 30 minutes, try to achieve the minimum recommendation. Then now you have selected your aerobic activities. It can be running, jumping jacks, indoor aerobic, or you can use your machines. Then you can do your core strengthening. It can be Pilates, lunges, plank, crunches, or squats. You can do without weights, then you can progress as we discussed. Then a neuromotor exercise, you can use yoga asana if you like, or I will show balance and coordination moves, a few examples, so you can add those to the neuromotor exercise. Finally, you should do the cool down part. So know before you plan your exercise program. These are important facts. So benefits of exercise far outweigh the risk. There is a little risk also, because we are risk for muscular skeletal injuries, and we are risk of sudden cardiac death and arrhythmias. Those are very rare. So, but the benefits always outweighs. So design goals to meet individual health and physical fitness. So your goal is up to you. So someone is having more goals toward the cardiorespiratory endurance. Someone is focusing more about the body composition regarding fat losing, and someone is more concerning about the flexibility. So their goals can be different. So design your goals to meet individual health and physical fitness. Then exercise program should be combined with active lifestyle to prevent counterproductive adverse effect from prolonged sitting periods. And these factors to be considered when designing an exercise program: individual's goal, physical ability, physical fitness, health status, time schedule, physical and social environment, and available equipments and facilities. There should be a cost-effective and enjoyable and easy equipments and facilities. And don't forget about the footwear. It should be nicely fit to your foot. There is a toe box and the sole. Sole is consisted with the inner sole, midsole, and outer sole, and the heel box. Those parts of the shoe should be nicely matched with your foot. So toes should not be congested. So, and there should be a nice shock absorbing effects. So there are several things to look at when we selecting footwear, and it starts slowly and build up gradually with your exercise program. And variety is important. That's the most important things. Select at least one exercise from each category, and watch for your warning symptoms and signs. Those are basically musculoskeletal injuries. So I will summarize up to now what I discussed. Steps are: first, we decide our goal. Then we do PARQ self-screening. That means physical activity readiness questionnaire screen. If there is a positive marks in that screening, we go for a doctor to get the medical clearance. Then doctor will give the exercise prescription to follow. Otherwise, you can start mild to moderate general exercise routine at home, and you can progress as we discussed according to FIT-VP principle. That's the summary. So there are practical measures to increase physical activity level and occupational settings. So we can break sitting period and minimize sitting duration by standing or doing few squats in between. We can do 5 squats and come to work, and walk during working period. Use stairs as much as possible. No elevators for first, second, third floors, and no need to use elevators. And walk to work and walk to home, and park the car away if possible. Minimize three-wheelers and taxi if possible. follow correct sitting, lifting, and standing postures. These posture disciplines are very important. If you are having back pain, musculoskeletal pain, you have to think about these posture disciplines also. Drink water frequently to keep your activity level throughout the working period. Follow the same principles at home. Talk about physical fitness, exercise, and diet with friends. That will keep you motivated. And gym within the office. Office, you can arrange physical activity programs, and you can have a TheraBands with you. Then you can do that TheraBand exercise at working place. And chart daily step counts with the smart devices. Now even even your watch, smartphone have these techniques. As well as we plan exercise routine and workout, we should plan the rest of the day also. And that's why these practical things are important. These are these are the few facts. You can add more think if you think. So many types, many plans, many websites have. What important here is to start something, even with the mistakes. So you don't want to wait until you become perfect on technique and everything. You can start from tomorrow onwards. So before we discuss about the obesity, our next part, so have 1 minute for this interesting social media post regarding fitness. Then we move to discuss about the obesity. Okay, I hope you watch that social media post. So now let's talk about few principles regarding obesity. You can see two state of mind set here. One is upset about his current obesity, especially central obesity, and other guy looks proud about it. What we can do is we can give information, but particular person should have the real necessity to get rid of it. Giving exercise prescription and diet plan alone will not solve the problem most of the time. I'm going to skip this epidemiology data. You already know how serious the situation is. And obesity is not about only increased weight. It is accumulation of excess fat in the body, which is associated with adverse health outcome. So there are methods to measure fat content in the body. Skin fold calipers we can use at home setup, and body circumference measurements, dual energy X-ray absorptiometry, DEXA scans, and hydrostatic weighing, air displacement plethysmography, and bioelectrical impedance analysis, BIA. Those gadgets can be found even in a treadmill. Some treadmills has that technique. So likewise, we can measure our fat percentage. So what about BMI? BMI is not a good indicator to comment about obesity because it takes body weight, not the fat amount. There can be high BMI people with low fat, and they will have high lean body mass. So in that case, they are not obese, even though their BMI value are high. So we can calculate our body percentage at home if we have a caliper, skin fold caliper, then take the measurements correctly. There are techniques for that. So take the measurements, then simply you can add those, enter those measurements into online calculators are there. Then they will calculate the body fat percentage. Usually, if the fat percentage is more than 32% in women or more than 25% in men, are considered in obese. So this is not to read, but just to show the problems that are linked with obesity. There are so many health problems, not only health, it affects physical fitness by altering body composition also. So I'm not going to read all the list. And again, there are so many causes for the obesity, but here we discuss about the simple obesity. We should suspect about other causes of obesity when there is poor response to lifestyle interventions. Here we are simple obesity, which is mainly due to obesogenic environment. There are political, social, family, and environmental causes for the simple obesity. So this environmental obesogenic environment is causing simple obesity, which is basically due to excess calorie intake and physical inactivity. You can read about the other causes as well. So there are two common morphological patterns of obesity, apple and pear shape. People who have metabolic syndrome typically have apple-shaped bodies. They have larger waists and this increased waist circumference is a high risk factor than BMI for cardiovascular diseases in both men and women. Unfortunately, South Asian tend to have apple-shaped obesity. Cutoff limits of waist circumference to detect central obesity for South Asian populations are equal or more than 90 centimeter in males, equal or more than 80 centimeters for female. You have to measure the waist circumference in correct technique to comment in correct way. There is no specific exercise to reduce abdominal fat only. There are exercises for the abdomen that will strengthen your core muscle, including anterior abdominal wall muscles. With that, you may get the feeling of reduced abdominal fat, but it is false. If you want to reduce abdominal obesity, it is the same principle we should follow like in general obesity. So to get rid of the obesity, we need to mobilize our fatty acid from the stores. So lipolysis predominates under 4 conditions: low to moderate intensity exercise, low calorie dieting or fasting, cold stress, and prolonged exercise that deplete glycogen reserves. 3 and 4 measures are not practical, and we should target 1 and 2 options here. So physical activity alone can't solve obesity. To burn 1 kg of fat, that means 9,000 kilocalories, we have to cover 140 kilometer distance. It is roughly 45 hours walk. Therefore, it is difficult to burn fat with exercise alone. Most people get discouraged and after months and months jogging with no single result. So how do you get rid of this obesity? First, we should try lifestyle modification in a comprehensive way. It is called high-intensity comprehensive lifestyle interventions. If it is not responding only, we can think about other options like drug management and bariatric procedures. High-intensity comprehensive lifestyle intervention includes diet control. Diet is a different one-day topic, and I am not the right person to talk about it. But mainly, main thing is to have calorie deficit, not more than 500 kilocalories from normal requirements. And we should not cut other nutrition like protein, minerals, vitamins. We should ensure good water intake throughout the day also. Exercise will not be easy for obese people. In that case, we can recommend low impact aerobic exercise like walking, cycling, swimming, and other aquatic exercises. Aerobic machines like Orbitrack stationary cycles are good. Once they are getting some amount of some level of fitness, they can move to other exercise also. But initially, low impact exercises are good. Then we must promote strengthening exercise, especially core strengthening and major muscles. Gradual progression during doing variety of enjoyable exercises and persistent of the exercise program are the key things. We can calculate our own daily energy requirement by using Harris-Benedict equation. or in an easy way by using online calculators. Our energy intake is always from food. Energy expenditure is done by mainly in three ways: basal metabolic rate, which is responsible for 60 to 75% of our energy expenditure, and thermic effect of food, which is responsible for 10%, and other physical activities. Those are 15 to 30% of range. So these are the energy expenditure methods. So what can we do is we can control food intake, keeping calorie requirement with small deficit while increase energy expenditure. When we go to increase energy expenditure, it is difficult to increase energy expenditure by increasing activity level alone. But if we can do resistance training also, it will increase or maintain lean tissue and maintain basal metabolic rate without letting the BMR to go down with calorie deficit. So mixture of aerobic and strengthening exercise will spend 200 to 500 kilocalorie amount while maintaining BMR in normal level. This will reduce the weight in healthy way while building overall fitness. There is no risk of regaining weight because we maintain the BMR that gives good energy expenditure. And we haven't done too much diet restriction either. So there won't be compensatory eating later. It is advisable to keep only around 500 kilocalorie deficit per day from your total energy requirement with the help of exercise and diet control. In that case, you will have 1 kg weight loss per 2 weeks. That 1 kg will be the fat you lose rather than muscles. We need to lose fat, not the muscles. So I would a little bit about childhood obesity. I would say childhood obesity is serious than adult obesity because they tend to be sedentary since childhood and they have early NCD risk. Sadly, more than 75% of obese children becomes obese adults. So this is a good document that has been produced by the ministry regarding childhood obesity, including the solution for it. This is a prevalence study about doctors' exercise level, which was done by me a few years back. According to this study, only around 9.2 doctors were doing adequate amount of exercise. This physical activity promotion program is being done island-wide by NCD unit and Sri Lankan Sports Medicine Association. These materials are giving valuable information for health and active lifestyle. Exercise as primary and secondary prevention of NCDs. There is no big difference in disease-wise in recommendation of exercise as primary prevention. If we can achieve at least minimum exercise recommendation, it will address all. But for the secondary prevention and therapeutic purposes, exercise should be done under special prescription and precautions to avoid disease-related or exercise-related medical problems. That should be discussed in separate presentation. Today we discuss about exercise on a healthy person as a beginner. Next, as an extension of this presentation, we can discuss how the exercise are applied on special populations like older adults, obese, pregnant, and children, and how this exercise can be used for the patient with NCDs and other chronic disease. You will also get bored if I add part to this. So this will be our next talk as extension of this presentation. So I must thank to GMO Sri Knowledge Academy for giving this opportunity, and my colleagues, senior colleagues and teachers, especially Prof. Aranjan Karunanayaka, for giving the support for this presentation. I hope now you are equipped with necessary tools to change your lifestyle into active one. I would do better demonstration and discussion in case we meet in a physical activity promotion program in hospitals. Let's see in future. And thank you very much for enthusiastic participation. Thank you.
Thank you very much, sir, for your excellent and very comprehensive lecture on exercise. And also there are few questions which which was sent to us previously and in the chat box. Is it okay to ask them?
Oh,
What are the exercise types for knee joint osteoarthritis?
okay. We are going to discuss about those topics in next presentation in details. Sadly, I don't have some diagrams and photos, but I will touch in brief. So for the knee joint osteoarthritis, what we generally recommend is we need to have good periarticular muscle strength. So strengthening exercise will be important here. So we need to do like knee joint extension and flexion exercise gradually. There should be a progression to have a good muscle bulk, quadricep muscle bulk and hamstring muscle bulk that will reduce the joint joint forces, and that will protect the joint. Another thing is in arthritis patient, they tend to have low cardiorespiratory endurance, flexibility. So we need to improve the physical fitness as a whole. So we need to do possible aerobics, and we need to do flexibility exercise. So we should look at as a whole. So we need to improve general physical fitness as well as the perimuscular strength. So those are the principles, and then we will discuss more in when we are doing that. This is part in next presentation. I think that's the thing I know, because I am still learning. So if there are more things, I will come with that in next presentation.
Then say it has been asked exercise types for backache. I think it also will be
yes, those are the
the
important
next.
topics. We are going to discuss those topics separately in next presentation with the photographs and the demonstrations. Here I will give some brief things about this backaches. We need to have good core muscle strength. We need to have good back muscle strength. So strengthening exercise are important. And again, we need to build overall physical fitness. While building overall physical fitness, we focus about the back muscle strengthening and perivertebral muscle strengthening. So unfortunately, I don't have photos of those exercises. So I will put those photos in next presentation. So those can be done to improve the lower back pains, especially for musculoskeletal type lower back pain, not for the serious pathological conditions. These should be applied musculoskeletal type non-specific back pains. So there are so many exercises to do for the lower back pain patients. Especially we need to build the overall physical fitness, body composition, muscle strength, and core muscle strengthening is very important.
Then sir, precautions and measures we should take regarding muscle injury after exercise.
Yes, there is the separate talk, but basically there are phases. So rehabilitation should be done. We should let the injury to recover fully before we engage in exercise. Otherwise, we can aggravate the disease condition. So there are separate phases. We do isometric exercise and isokinetic exercise, strengthening exercise. Finally, sport specific exercise. It is a gradual process. So with that process, we can have good outcome from that injury. Otherwise, that injury become chronic state. That patient can have re-injury. Then it can affect his mental state also. So this chronicity should be broken down. Then and nice rehabilitation should be there.
What are the exercise types we can do to get maximum benefits with minimum duration?
So for the beginners, it is not advisable to get high intensity exercise for short duration. But if you are asking this high intensity exercise, I would recommend the HIIT type high intensity interval training that will give the same benefits as conventional moderate intensity aerobic exercise. Though there are so many types of HIIT exercise. You can study about those high intensity interval training exercise. If you have a treadmill at home, you can use that treadmill as HIIT high intensity interval training. Then during that within a short period you can have maximum benefits, but not good for a beginner, I would say.
So that in high intensity interval training exercise, how long we should exercise and rest, rough working schedule?
So roughly we do 2 minutes high intensity. It depends on person to person. So high intensity means it is an individualized thing. My high intensity level is not the same for other person. So when you are doing high intensity, it is up to you. So that high intensity should be done for 2 minutes, then low intensity should be done for 2 minutes, then again high intensity should be done 2 minutes, low intensity should be done 2 minutes. So roughly if you can do 3-4 cycles, or if you can do 8 to 10 cycles, it is up to you. It should be done gradually. So there is no fixed cutoff limit. So you can progress even in the HIIT exercise. You can progress. Main things what I know is that 2 minutes, 2 minutes, 2 minutes, 2 minutes intervals we usually do in that way. I think I'm clear about that answer.
I think, sir. Also, I ask if any participant have any queries further on that. Please send a message to the chat box.
Yes, you can find me on Facebook. You can put a message there.
Then, sir, what kind of food supplements are recommended for bodybuilders? Whey protein was locally available foods.
Yes, yes. We usually recommend go for a natural food. So we don't encourage supplements as much as we can. So try to have your protein intake with natural food items. That's the thing I recommend. I don't have much knowledge about the supplements. I will come with better answer next time.
Recommended exercise for elderly. Any harms of starting strenuous exercise in elderly?
For if that elderly person is starting exercise at first time, he should better he should follow that PARQ questionnaire, physical activity readiness questionnaire, and check about himself. That is a self screening. So if it is okay, he can start with mild intensity aerobic exercise, then gradually progress. As we discussed, there's no harm of progressing gradually. So he can progress in aerobic exercise gradually, then he can start with a strengthening exercise with low intensity, with high repetitions and low intensity strengthening exercise. So then he can progress in that way in strengthening exercise and aerobic exercise. And don't forget about the that balance and coordinating movements and flexibility exercise also. Those are very important in elderly persons. So it is about overall exercise schedule. So we have to select variety of exercise to target each and every components of the physical fitness. No harming about starting exercise at the elder age.
Then, sir, as you mentioned, the childhood obesity is a serious problem. And what are the exercise types recommended for children? The better exercise types.
Yeah, there actually We don't recommend fixed exercises for children. We allow them to have whatever the enjoyable activities, because they can have good physical activity with sports, and it will be a great pleasure to them. So if there is a fixed schedule, the adherence will not be there. So try to encourage more free physical activities, whatever the things they can enjoy. That's the most possible way, I would like to say. And other than that, I don't think that fixed exercise schedule will not be beneficial, or will not be effective for that kids.
Then, sir, applicability of body mass index for bodybuilders.
Yes, I think I mentioned about that in the presentation. BMI is not the good indicator to have idea about the lean body mass and fat mass. So to have idea about the fat mass and lean body mass, we need to analyze our body composition. Like I mentioned, there are so many ways. BMI is a rough idea. You can have, you can say I have good weight to height. That's the only thing we can say. But for the body composition, to know about how much lean body mass I have, so how much fat mass I have, we can't say with the BMI values.
Then, sir, what is chair aerobic exercise?
Yes, chair aerobics can be done at home or at working place. There are separate set of exercise. It is coming under the aerobic exercise. So I will prepare slides for next presentation. So I need to show some diagrams and photos. Those can be done easily. But if you can, if you have facilities, so if you can do other aerobics activities, it is okay. It is good, because chair aerobics are chair aerobics we have to do by sitting on a chair.
So you mentioned about the warm up also. What is the meaning of this warm up before exercise, and is it necessary?
Yes, warm up is very necessary. It will reduce the injury risk, and it prepare our body for the workout. So we need to get our pulse rate. We need to have the good blood supply. So it will ready our body physiologically for the workout. So workout will be easy without minimum risk of injuries. So warm up is very important.
Then is it before every exercise, or what kind of before what kind of exercise we need warm up?
Yeah, warm up should be done as for each and every exercise sessions. So if you are doing aerobics, or even you can start with joint warm-ups, head forms, cervical spine, shoulder, then the lumbar spine, knee, hips. You can start warming up your joints. Then you can start aerobics from mild intensity to high intensity. So that will give you a warm-up part and the aerobic activities. But most importantly, you have to do separate warm-up exercises before you go for the strengthening exercise. Time duration can be vary person to person. Some may need 15 minutes, some may need 30 minutes also. For the beginners, it is 5 to 10 minutes will be enough. So time duration will vary, but you should do warm-ups.
So what time is better to do exercise? The morning or evening is better?
There is no such recommendations like that, as I know. So any time which is feasible for you, you can start your workout routine. So if you are doing workout at daytime, so you better not to do aerobics outside, because this we are in hot climate, so you may have adverse effects, dehydration, then heat injuries. So it is better plan your time, and you make your own individualized workout plan, then it is easy to adhere. So there's no such recommendation about morning is better, night is better, as I know. So you can do your workout as you plan.
So following a viral infection, how long a patient should rest prior to getting back to previous exercise routine, like walking and cycling?
Yes, following viral illness, you should recover. You should recover fully. So there should not be any generalized symptoms like shortness of breath or body aches and pains, myalgia. So you should recover fully to have exercise routine. So I would say you can start aerobics from mild to moderate intensity, and you can progress. You need to wait until 1 week to have 10% of progression. But you can start with mild to moderate intensity at first after recovering fully, and you can progress up to your previous level when you feel well.
Where can we find the books regarding overweight and booklets on promotion of exercises prepared by College of Sports Medicine?
Yeah, that I think I showed that book that can be downloaded in the ministry website. I think we are doing that physical activity promotion program in collaboration with the NCD unit ministry. So Sri Lanka is Sri Lanka Sports Medicine Association and the NCD unit have done that project. So there's a nice booklet where you can find those physical advices regarding active lifestyle. That book is good.
Also, sir, if you have asked, is there a way to arrange a demonstration of basic workout for healthcare workers at hospital level or at peripheral hospital levels?
Yes, currently we are doing those kind of activities. It is mainly done by NCD unit ministry, and then we going and join for their program. So it can be arranged. I think your hospital doctors, MOHO, health promoting doctor, through that doctor you can arrange those activities. It is there are so many resource persons are there. So one of resource person can come to your hospitals. Those are very effective programs. I think personally I did several programs, so people are gaining a lot from that demonstrations, and we can discuss face-to-face problems, and we can demonstrate physical activities and exercise techniques. We can correct techniques. So those things can be done easily with that physical meetings. So contact NCD unit. I think they will have plan for those kind of activities.
Then, sir, what are the recommended exercises for pregnancy?
Pregnancy is a different topic. I currently I don't know much about that. I am still learning. I'm training, so I will ask from my teachers. So, and I would ask from some consultant for the better recommendations. Currently, what I know is we can, if that pregnant lady was doing exercise previously and fit, and it is okay, she can continue in mild to moderate intensity, like simple jogging, walking, like exercise throughout the pregnancy. No problem. That recommendation wise, pregnant lady can continue exercise. There's no restriction unless there are proper contraindications. There are a list of contraindications. In that case, you can't do exercises. If you don't belongs to that contraindication list, you can continue exercises, and you can continue even strengthening exercise also. We recommend major muscles strengthening exercise with high repetition and low intensity. So strengthening exercise, aerobic exercise can be done according to the recommendations. But more than that, I would like to ask from teachers and the consultants whether there are any specific recommendations and exercise to be done for the pregnant women. But check about that contraindications. If there should not, you should not have those contraindications to do exercises in especially during pregnant period.
Okay, thank you very much, sir, for your very detailed lecture, and also for answering all the queries. So the link for applying the e-certificate for your participation has been sent to the chat box, and also your feedbacks will be very much helpful for us for the development of future CPD programs. This webinar will be available to you in the Sri GMOA YouTube channel in couple of days, so you can go through it again. I thank Dr. Rishita, Vijay, Surya again for spending your valuable time with us. Also, finally, I thank all the participants for participation for today's webinar, and also we invite to join with the every single CPD program in the future. So as Dr. Rishita mentioned, I like to mention at the end, you can contact the NCD unit to get further information if you want to plan any workout program in your hospital levels. Thank you very much.